Good afternoon, my name is Amber Ramirez, and I will be talking to you about how to prevent and reduce the incidence of nosocomial infections. First of all, what is a nosocomial infection? Nosocomial infections are also known as healthcare-associated infections, or HAI for short. These infections are infections that patients acquire while receiving medical treatment in a healthcare facility, and they can be caused by bacteria, viruses, fungi, and other less common pathogens. Given that modern healthcare has advanced in such a way that more invasive devices and procedures are being used to treat patients, infections arise from the use of these invasive devices, such as ventilators and catheters. Which brings us to the categories. These nosocomial infections can be categorized according to their site of infection. And the four main categories are central line associated bloodstream infections, catheter associated urinary tract infections, ventilator associated pneumonia, and surgical site infections. So, how common are nosocomial infections? Well, according to the CDC, it is estimated that every day at least 1 out of 25 hospitalized patients has at least one healthcare associated infection. Most recent data shows that there has been no change in overall catheter associated urinary tract infections, but there has been a 50% decrease in central line associated bloodstream infections, a 17% decrease in surgical site infections, and a 13% decrease in hospital onset methicillin-resistant Staphylococcus aureus. Also, here we have a table with a summary of the total number of infections in hospitals with each major site of infection in the year 2011 for all U.S. acute care hospitals. As you can notice, both pneumonia and surgical site infections have 157,500 cases reported, leading in the primary cause of infections in that year, followed by gastrointestinal illness with 123,100 cases, and urinary tract infections, 93,300. On the other hand, in Puerto Rico, we have very little information given that not all hospitals report their nosocomial infection outbreaks. So from the little information that was reported, we can see that CLABSIs, or central line associated bloodstream infections, reported no significant change between the year 2013 and 2014. GAUTIs, on the other hand, catheter associated urinary tract infections, reported a significant decrease between the year 2013 and 2014. In this table summarizing Puerto Rico's cases that were reported, we can see that comparing the year 2013 and 2014, CLABSI and GAUTI were both decreased by a 25 and 34% respectively. But in comparison to the nationals SRI, we have that CLABSIs in Puerto Rico are 18% higher, but GAUTIs are 48% lower. So that's so you get a sense of how Puerto Rico compares to the United States. Now, how are nosocomial infections categorized? As I mentioned before, they're categorized according to their site of infection. So we have the four main categories, and we're going to start with central line associated bloodstream infections, or CLABSI for short. These are caused or are a serious infection that occurs where germs enter the bloodstream through the central line. So what is a central line? Central line is a tube that is placed in a large vein in the neck to give medication fluids or collect blood samples from patients, and it can remain in place for weeks or even months at a time. It is mostly used in ICUs or intensive care units in hospitals. Some of the symptoms of these infections are fever, red skin, and soreness around the central line. And a risk factor is the prolonged use of this central line, which can result in thousands of deaths each year. Next, we have catheter-associated urinary tract infections, or CAUTI for short. And these occur when germs enter the urinary tract through the urinary catheter and cause an infection involving any part of the urinary system, including the urethra, bladder, ureters, and kidney. And a urinary catheter is a tube that is inserted into the bladder through the urethra to drain the urine. And I should mention that it is the most common type of healthcare-associated infection or nosocomial infection. Some of the symptoms are pain in the lower abdomen, fever, burning during urination, and increase in frequent urinations. And a risk factor is also the prolonged use of the urinary catheter. I should mention that around 25% of patients receive catheters at some point during their stay at the hospital, which makes them have a higher risk of acquiring this kind of infection. Next, we have ventilator-associated pneumonia, or VAP for short. And this is a lung infection that develops in a person who is on a ventilator when germs enter through the tube and get into the patient's lungs. A ventilator is a machine that is used to help a patient breathe by supplying oxygen to a tube placed in the patient's mouth. Some of the symptoms of this infection are fever, purulent tracheobronchial secretions, increased respiratory rate, and a decreased oxygenation. A risk factor is smoking, which weakens the lungs, and prolonged use of the ventilator. Lastly, we have surgical site infections, or SSI for short. And these are infections that occur after surgery in the part of the body where the surgery took place. Some of the symptoms are redness and pain around the area, fever, drainage of cloudy fluid from the wound, and some of the risk factors are diabetes, cancer, and other pre-existing skin conditions. Now, what microorganisms cause these infections? I'm going to mention the 4 most frequent organisms that have been identified with causing these kind of infections. And we will start with Acinetobacter baumannii. This is a bacteria that is responsible for around 80% of infections. It can cause pneumonia, blood, and wound infections. And some of the risk factors are a weakened immune system, chronic lung disease, and diabetes. And it can be transmitted from person to person or contact with contaminated surfaces. This is because this bacteria can live on the skin or surfaces exposed to the environment for several days, and it has shown to be resistant to common antibiotics. Next, we have Klebsiella pneumoniae, which is another bacteria. And interestingly, this bacteria is found in our normal intestinal flora, and it pertains to the family Enterobacteriaceae. An infection with this particular microorganism can cause pneumonia, blood and wound infections, and meningitis. Some of the risk factors are patients on long courses of antibiotics, and it can be transmitted from person to person as well as contact with contaminated surfaces. Next, we have Staphylococcus aureus. This bacteria has species that have developed antibiotic resistance, such as MRSA, VISA, and VRSA, and can cause bacteremia, pneumonia, endocarditis, and osteomyelitis. Bacteremia is an infection of the bloodstream, endocarditis is infection of the heart, and osteomyelitis is infection of the bone. Risk factors are having diabetes, cancer, some kind of vascular disease, eczema, or lung disease. And it can also be transmitted from person to person and contact with other surfaces. Lastly, I wanted to mention norovirus, which, as the name implies, isn't a bacteria, but rather a virus, and it is the main cause of gastroenteritis worldwide. Gastroenteritis is an inflammation of the lining of the stomach and intestines. Risk factors are young children, the elderly, or other pre-existing conditions. This virus can be transmitted from person to person, and eating or drinking contaminated food, contact with contaminated surfaces, and later touching your eyes, mouth, or nose. I should mention that it is very highly contagious, and it can withstand very high and very low temperatures, which make it a very pathogenic microorganism. Now, can nosocomial infections be treated? Yes, they can. That is the good news. But in order to correctly cure a patient from a nosocomial infection, doctors order laboratory testing to be done. Some microorganisms are harder to isolate than others, so when taking samples, precautions must be taken in order to avoid contaminating the sample and giving an incorrect diagnosis of the pathogen. So this helps identify the causative agent of the infection so that the doctor can design a treatment that can specifically attack the pathogen. I should mention that this is very important because antibiotics only treat bacterial infections. So if it's a virus, such as norovirus, as I mentioned before, antibiotics will not cure the infection. So depending on the pathogen is the treatment that will be advised by the doctor. So how can nosocomial infections be prevented? Some general precautions are that all medical personnel should wash their hands with soap and water or an alcohol-based hand rub before and after caring for each person. That is to stop the spread of infection. If a doctor comes and treats a patient that has an infection, then it goes treats another patient that isn't infected but doesn't wash his hands properly, they're exposing the patient to acquire this kind of infection. So the proper hand washing is key to stopping the spread of these kinds of infections. And not only doctors, but also anyone in contact with the patient. So this can be visitors or other personnel from the hospital. Also, all medical personnel should wear masks, gowns, and gloves when performing any kind of procedure, as you can see here in the picture. Also, equipment and surfaces must be disinfected on a regular basis. As I mentioned before, a few of the microorganisms that I mentioned are very resistant and can live in the environment for a couple of days. So regularly disinfecting equipment and surfaces can help stop the spread of these kinds of infections. Here we have a diagram of the sources of infection. See, we have a sick patient, and the sick patient is in contact with medical personnel, doorknobs, and other toilets and stuff that they can share with other patients, as well as medical equipment. So after all medical personnel treat that patient, they have to wash their hands and wear the appropriate gowns and everything to prevent the infection to another patient. All the medical equipment should be sterilized and disinfected between use from each patient. And surfaces, as I mentioned before, should also be cleaned on a regular basis. So specifically, nosocomial infections can be prevented by going into the categories. First, we have CLABSIs, or central line associated bloodstream infections. And the main thing here is to remove the central line as soon as it is no longer needed, because one of the risk factors was to leave the central line for too long. Also, in CAUTIs, or catheter-associated urinary tract infections, we have the same thing, to remove the catheter as soon as it is no longer needed, because the prolonged use of these invasive devices increases the risk of acquiring the infection. For VAP, or ventilator-associated pneumonia, we have a few specifications here. To keep the head of the patient's bed raised 30 to 45 degrees and clean the inside of the patient's mouth regularly. Also, we should clean or replace equipment between the use on different patients, as I have mentioned. And also, as with the other two, we have to take the patient off the ventilator as soon as it is possible, because the longer the invasive device is used, the higher the risk of acquiring the infection. Lastly, we have SSI, or surgical site infections, and the main thing here is just to keep the wound site clean, because medical personnel wash their hands and arms up to their elbows with antiseptic agents before the surgery. So they take the steps before, so the patient has to take the steps after to keep the wound site clean and not touch it. So what are some of the recommendations for lowering the risk of acquiring a nosocomial infection? So here I wanted to mention that hospitalized patients are always at risk of acquiring these infections, since their immune system is already compromised or weakened by some other primary infection or procedure. They're in a hospital for a reason, right? So their immune system is already preoccupied fighting some other kind of infection. So it's not really compared to a healthy person whose immune system is tip-top shape. So here I think the main goal is to orient employees on correct disinfection of equipment, surfaces, and areas that can be harboring these pathogens, let it be bacteria, viruses, or others, and to educate the healthcare personnel regarding the indications for all high-risk procedures and appropriate infection control measures to prevent these infections. And supervisors or administrative personnel should periodically assess the knowledge of and adherence to the guidelines for all personnel involved in the placing and maintenance of invasive devices, which I think is a very important point, because if there's nobody enforcing the guidelines and making sure that everything is done correctly, there is bound to be slip-ups and mistakes that can be very bad for patients mainly. So they should only designate trained personnel to handle procedures that are high risk. Also, we have to ensure appropriate nursing staff levels, especially in ICUs or intensive care units, because there was a study and it has been proven that understaffing is a big issue in hospital environments, because emergency-centered care facilities are very fast-paced and require employees, let this be doctors or nurses, to respond and treat patients quickly. And if they're understaffed, they need to be faster, which can lead them to skipping steps like, oh, I can't wash my hands before treating this patient because he needs help right now and there's nobody else that can help him, So it puts them in a very tough spot to choose between skipping a protocol, which can in the long run affect the patient. And lastly, we should investigate and consider changing the design of hospital rooms to single patient rooms instead of the open bay rooms. There has been investigation in this area, and I think I do agree with this, because a change in the design of the hospital can result beneficial for the patients, but also for the healthcare facilities, because it will be an investment in reducing the nosocomial infections, which result being very, very costly to the hospitals or healthcare facilities when eradicating or stopping the spread of these infections. So if you can prevent it, it's better in the long run. And I think the patients are the first or priority here, right? So we should work on preventing and not trying to treat later on. So these are my references, and thank you for listening.